I knew the content. I don't understand why I got the question wrong. If you've ever said that after an exam, you are in the right place. You're listening or watching Teaching Nurses to Think, a series from Nursing Success with Dr. Sherry. I'm Dr. Sherry, and we take nursing concepts or topics from nursing school and learn how to think through it like a nurse. So whether you're listening on your way to clinical, driving to class, or sitting down to study, I'm really glad that you're here. Let's jump in. So during exam reviews, I always have students tell me, I knew that content. I knew the material. I studied from A to Z. Everything looked familiar. But then when it came down to it, they chose the wrong answer. This happens so often. And I understand that it can be devastating and frustrating for you as a student when this happens, because those NCLEX style exams literally help get you through nursing school. So you got to get them correct. So let's assess and see if we can figure out what the deal is. Take a minute and think about how you study. If you really think about it, no one has probably ever really taught you how to study. If you made it to nursing school, chances are you were probably a straight A student. You probably never had to study for anything. You made it through your prereqs without any problems, and the world was good, right? You received the material, you looked at the information, memorized it just long enough for the test, and you aced everything. Sound familiar? Then nursing school came along and literally kicked you in your ASS and changed everything you thought made sense when it came to studying. Quick moment of transparency here. That exact cycle of memorizing everything is exactly how I failed out of nursing school. It wasn't because I wasn't smart. It was because I literally had no clue how to study. Good news is we can fix this, okay? So let's unpack why this memorization method doesn't work, and then we'll get into some things that you can start doing today to help turn things around. So if you're in nursing school, hopefully you've heard of Bloom's taxonomy. If you haven't, no worries. I'm going to break it down for you really quick, okay? So basically it is a framework used by educators to help determine your level of thinking. And it's in a pyramid format, just like Maslow's hierarchy of needs. At the very bottom of the pyramid, you have remembering. So if you think back to all of the other classes that you have taken, this is probably all that was required of you. All you had to do was memorize the information, and you were successful and you were the smartest person in the room. In nursing, you are required to memorize, but you're going to need a bit more than being able to memorize. For example, if you're in nursing, right now you might be an NA, you're somewhere in healthcare, normal O2 sat, 95 to 100%. Normal heart rate, 60 to 100. Normal respirations, 12 to 20. If you've done labs, then you may know that potassium is 3.5 to 5. And if you were in nursing school, you were probably reciting these numbers right along with me, because you remember, you have memorized this information and it is forever etched into your brain. So remembering does not go away once you get to nursing school, but you got to add some other steps along to it, which takes us to the next level of Bloom's, which is understanding. In your other classes, you may or may not have had to understand information. Nursing requires that you understand what it means to have a heart rate of 60 to 100, or what it means when the heart rate is less than 60, or if it's greater than 100. As we know, the body wants to operate in a place of homeostasis. So anything too high or too low is going to cause issues, right? Right. So now we have understanding. So you have remembered what was normal, and you understand that things can happen when things are not normal. Of course, in your classes, you're going to want to know what these things are that can happen when things are abnormal, because that's going to help you with the next level of the pyramid, which is application. This is the level where the majority of your exam questions and the NCLEX, this is where everything operates. Your exams in school and the NCLEX, they want to know if you can apply the information that you have remembered and that you understand. So let's go back to the normal heart rate of being 60 to 100. You understand that if it's too high or too low, that it could be detrimental to your patient. How are you now going to take the information that you remember and you understand and apply interventions to your patient to help them get well? So let's do a little comparison. So imagine I ask you these questions. What is normal O2 sat? What is normal heart rate? What are signs of respiratory distress? If these were the questions, I imagine everyone would get them correct, because the only thing you have to do is remember or memorize the correct answers. Everyone wishes that their questions in nursing school were just this easy, right? So now imagine I give you this example. A patient has an O2 sat of 88%. They're restless and using accessory muscles to breathe. What should the nurse do first? This question feels a lot different, right? It's the same information. The content hasn't changed. The difference is now you have to decide what matters the most. This is an example of an application question and why you cannot just rely on your memory alone. So here's the bigger question. What can you do to help you study better so you move beyond memorizing the material? That's the big question, right? So here are 3 things that you can start today to help you move beyond memorization and move towards application. Now, by the way, there are 2 more levels to Bloom's taxonomy, analyzing and evaluating. We will not get into those today. We're going to stop at application so that you can be at the basic level of your exam questions and the NCLEX. All right, so number 1, immediately after your lectures, you want to take a few minutes to review the material, review the notes that you took. And just a side note here, I know it's old school, but writing out your notes is still king, okay? Write out your notes. Research shows that writing out your notes helps your brain and helps you remember information better. So writing out things still helps. Sorry if I'm old school, but it's also research-based and evidence-based and backed up, okay? So write out your notes. All right, so after you look over your notes, you want to clarify with your instructor, professor, or one of your classmates if some of the information that you have seems kind of sketchy or shady, okay? Because you don't want to study material that is incorrect or that you don't truly understand. So that's the number 1 thing that you want to do. Plus, it's the first opportunity that you have to look over the information. The more you look over the information, the more of the information you retain for the memorization part, because you do still have to remember some things in nursing. Number 2, you want to rewrite your key concept. More specifically, you want to write it in your own words. You might create a concept map, a one-page summary, or even just a simple outline. The goal is not to copy your notes over again. The goal is to make sure that you actually understand them. And number 3, you want to take those key concepts and then turn them into scenarios. Ask yourself what decisions you would make if there was a real patient involved. For example, if today's lecture was on heart failure, don't stop after you review the signs and symptoms of heart failure. That's your remembering part. You want to move beyond that. Yes, you want to study the signs and symptoms. You want to remember them. You want to understand what happens, because then you want to start to ask yourself, what if my patient's O2 sat suddenly drops? What would I assess first? Who would I notify? What interventions can I do independently? Because if you can't get that provider, you as the nurse, you need to be able to do some intervention to get your patient feeling better. And so let's just recap. So number 1, immediately after class, you want to clarify all of your notes. You want to reread all of your notes and clarify anything that seems kind of muddy. Number 2, you want to put your key concepts on a concept map or rewrite it in your own words so that you have a good understanding of everything. And then number 3, you want to turn all of your key concepts into scenarios, not just memorizing the signs and symptoms, but asking yourself, what am I going to do if those signs and symptoms kind of gets out of whack? What would I do for my patient? And here are a few bonuses just because I have so many things in my brain and I have to get them out. So bonus for you, okay? Quiz yourself every day. You want to be practicing NCLEX style questions all the time. It's going to help your brain and it's going to actually help build stamina for when you actually take your NCLEX. So you want to practice NCLEX style questions, and you don't want to just focus on, yay, I got the wrong answer, but do you know why you got the right answer? What was the rationale behind it? Why did you choose that answer? Because it's not just about choosing the right answer, but knowing why you chose that answer. Okay, so practice NCLEX style questions daily and make sure you understand the rationale as to why you chose the answer that you did. Why is the correct answer correct? Why are the incorrect answers incorrect? Be sure that you know that information. Additionally, you want to make sure that you can teach the material to someone else, because someone or something. So if you can get in front of the mirror to your spouse, your friend, your dog, whomever, it doesn't matter, but teach the material to someone else. Either teach it out loud or do a brain dump on a whiteboard and see what information you are already retaining. And then begin to fill in the blanks with the things that you left out. But teaching it to someone else literally forces you to think and to think on the spot. So definitely try that as well. And one more thing, okay? Last thing, seriously. Do not be afraid to use AI to assist you. I know there are so many people out here who are against AI, but AI is a tool and resource that can literally help make your life easier and simpler while you're in nursing school. I'll dive into AI and how to use it effectively and efficiently while you're in nursing school in another episode. I truly hope that this episode has encouraged you to think a little bit differently about how you study. Always remember that nursing school is not about memorizing the most information. It's about learning how to think through patient situations and make safe clinical decisions. If you enjoyed today's conversation, I would absolutely love it for you to subscribe to my YouTube channel as well as my Substack, Teaching Nurses to Think. And that's where you'll find the written version of these discussions that we're having, along with some additional resources that will help you to become a more confident nursing student. Thank you so much for spending a little bit of your time with me today. Until next time, don't just study nursing, learn to think like a nurse. I'll see you in the next episode. Bye.